healthcare workers is currently administered at 4 hospitals in Mpumalanga. Over 51,000 healthcare workers are expected to be vaccinated in the first phase of vaccinations. The province received 16,000 doses of the Johnson & Johnson vaccines in February. SABC News reporter Tumelo Machogo spoke to the Mpumalanga Health MEC on how the rollout is going in the province.
Well, vaccination is currently underway here in Mpumalanga with healthcare workers receiving the jabs from Johnson & Johnson. You remember that Mpumalanga province received about 14,400 doses of the Johnson & Johnson vaccine, and also healthcare workers have been vaccinated in a number of hospitals across the province. But let's speak to the MEC of Health in the province, MEC Sasekane Manzini, just to hear about how's the process of vaccination, especially to the healthcare workers, is going here in the province. Mr. Sasekane, thank you so much for joining us. Just talk to us about the vaccination process. We know that you guys receive about 14,400 doses. How many healthcare workers have received these jabs, and how far are we going with the vaccination process?
Thank you very much. Indeed, as a province, you'll remember that where we are at Rob Ferreira, that's where the Premier officially launched our vaccination plan. We started here in Witbank, and also here in Rob Ferreira, and also in Witbank. So far, we have received 16,698 vaccine in the province, and the remaining number of vaccine that needs to be for people to be vaccinated are 1,999. So far, I can indicate that we have got 4 facilities that are remaining with vaccine, which is your Ivanda, your Shongwe, your Mpumalanga, and Cosmo Life, which is a private hospital, because there is an allocation for also private and public, meaning that when we identify the facilities that we are having in the province, does not necessarily mean that only healthcare workers in that facility were vaccinated. So like you go to Nkomazi, we were at Shongwe, but also people from healthcare workers from Shtonga, and also PHC around. So we can say that with the allocation that we got, of course, we still need more, but the allocation that we have got is going very well. And we want to thank our frontline workers, because they are coming out in their numbers to make sure that they take part in the vaccine, so that they are able to be safe for them to assist other people, because the approach of phase 1 on healthcare workers was necessary to make sure that they are safe, because we don't want to lose even one healthcare workers with the shortage and the human resources scarcity that we are having as a province and as a country.
May I note some of the hospitals, such as Rob Ferreira and also the one in Witbank, they've been deactivated. Does it mean that the areas around this, the catchment area around those areas, have already been reached, and people have already been vaccinated that need to be vaccinated in those areas, such as like Mbombela here, and you talked about Mpumalanga Hospital also in Bushbuckridge, which is catering not only for Bushbuckridge but also for other areas such as Tabacho municipality and all those areas?
As and when we receive the batch of the vaccine in the province, that's where we extend. So for Witbank and also Rob Ferreira, hence I'm saying the only 4 that are remaining, is that when we are done as far as that facility, we then review, then we put other hospitals with the new allocation that we're going to get. By so doing, we want to minimize people traveling from one facility to the other. Like I indicated earlier, that even if it's Rob Ferreira, does not necessarily mean that only workers from Rob Ferreira, but also from nearby facilities. So it means that when we get the 3rd batch as a province, we'll then extend to other facilities, so that we cover as far as possible many healthcare workers in the province.
May also just talk to me about, we've seen that yes, healthcare workers are being vaccinated. Just talk to us about how many still need to be vaccinated. We know that there are about 51,000 healthcare workers in the province alone, and how many of those have been vaccinated? How many still need to be vaccinated, especially if you guys get another 2nd batch of the vaccine?
As I've said, so far we received 16,698, and out of that we are remaining with 1,999. So the 50,000 people that we are having healthcare workers in the province, then it means there's still a lot. But hence I'm saying we are happy that we have had the pronouncement that we will be receiving around 30 million vaccine as a country. So that on its own, it tells you that it means the allocation of the province will then increase, so that we are able to vaccinate all the healthcare workers in the first phase, so that we can start. Because what is important is that we need to move towards vaccinating the community. So where we are as a province, we are saying we are looking forward to the 30 million that we are told that it is going to be in the country before the end of April, so that then we can start rolling it out. Hence we are preparing as a province to start to identify areas in the community where we'll vaccinate the members of the community. So I can say that the more we get is the more that we are going to roll out in the healthcare workers, both private and also public. But we are looking forward to the rollout to the community, because the community are saying, no, MEC, we are waiting. We were seeing healthcare workers, but we want to thank healthcare workers because they led from the front, meaning that we're able to even those that had doubt in terms of the vaccine is concerned. But if they see doctors, nurses taking the vaccine, it tells you that now the community are saying we can't wait to get the vaccine, of which that on its own is assisting us as a province and as a country.
Okay, somebody will say the rollout has been very slow because of 16,000 that you can do within like 2 weeks. It's already been over a month now since you guys have got this vaccine. Why is the process moving this slow?
It's not under our control as a province. We vaccinate as we receive from the national. So this number is the number that we've received as a province. So when it comes to the province, we don't take time to make sure that, as I'm saying, in other areas, I remember in Mpumalanga, they were even fighting to say, no, want to be part of taking the vaccine. So that is determined by the allocation that we get from national. Hence, I'm saying we are excited of the 30 million that we are told that it is going to be in the country by the end of April. So that number on its own tells you that we'll then be able to conclude the first phase of the healthcare workers in the country. Then we'll move to the communities. That's where also, so that we can reach our more than 67% of people in the country being vaccinated. So that's what we are looking for, and hence we are working together with national as far as making sure that we get the allocation also as a province.
May just one question also, just talk to us about, we know that yes, people have been vaccinated and they are receiving vaccine, but you know, Nehau has been saying that there's been a delay because some people, because of network issues and other challenges. What other challenges would you say that is also kind of like delaying this process? Because Nehau is talking about the issue of connectivity, the issue of people not getting their vouchers on time and all those kind of things. Your response to that?
When we started, that was a problem across the country. Hence, the minister convened a special NHC meeting where these issues were raised, and we've agreed in terms of saying, because previously they were saying if you don't have the voucher number, you can't be vaccinated. That is something that we have corrected. They are able to come, they are assisted in all these identified facilities where they are getting the vaccine. So I can say so far we no longer have that challenges that we had previously. And I want to thank the organized labor in the province because they also participated and they also took the vaccine. That on its own brought confidence to the workers to say they must take the vaccine. So where we are, we can say that the only challenge that we are having is that we need more vaccine for our people because we can't wait for long, and especially from the side of the healthcare workers also. If we can complete that first phase so that we can now roll out to the communities. But so far I can say that the program is going very well, and I know that National is doing their best to make sure that we get more vaccine to the country.
May, one more question. Talk to us about the numbers now. We know that the numbers have been going down. We know that Easter is coming also, and we know that province have not had like a huge numbers. What do you think it's helping the province to actually mitigate, and the numbers are being very down, they're not going up as we've been seeing other provinces? And also talk to us about the appetite of healthcare workers wanting to get this vaccine.
Yes, you are correct. You remember that after the festive season, we were worried because we started to see our numbers increasing. But now we are happy that we are going back to where we had the 1,000, less than 1,000 a day active cases. And that is based on the working relationship together with the communities, because you can't fight COVID-19 as government alone. You need all key stakeholders. And in the province, what the Premier did, the ward-based model, all stakeholders at the level of the ward, municipalities working with us, traditional leaders, all religious leaders, so that we are able to fight this COVID together. The behavior of our people, we are seeing it changing slowly. Of course, that people are now starting to understand the importance of the health protocol, your wearing of the mask, washing of your hands, your social distance. But of course, a lot still needs to be done. We know that now, tomorrow is Good Friday, the excitement, and we are happy that the president at least tried to tighten the regulations so that we are not overexcited over 3-4 days, and the impact of that will be huge for us, where we'll be able to have more people being infected and losing their life. So I can say that that's where we are as a province, and of course the excitement from healthcare workers. Now we no longer have to go to a facility and try to convince people to take the vaccine, because they understand that on its own, government is trying its best to make sure that we are safe, especially from the level of the healthcare workers, because one healthcare worker is assisting more people, so we can't afford to lose them. So I can say that the working relationship that we are having with the union, with the workers, with the community at large in fighting COVID-19, indeed, it has yielded positive results. But of course, we don't want to lose even one person out of COVID-19. We don't want to have more people being infected also that. So I can say that that's what we need to do to continue to work with our communities to fight COVID-19.
Thank you so much. That was Sasekane Manzini. She is the MEC of Health here in Mpumalanga, talking to us about the challenges that they've been facing. She's saying that the challenges that they've actually been facing is actually the issue of more vaccine. They want more vaccine so they can vaccinate more healthcare workers, also to start vaccinating the public in general. But they're saying that the slow process is also because of they don't have enough vaccine to the province to actually roll it out. But the vaccine saying that if the more vaccines are arriving, they will continue with their vaccination process. We know that 4 hospitals are currently doing their vaccination process, and they are continuing almost on a daily basis in those hospitals to ensure that more healthcare workers are vaccinated in the province. Back to you.